Chiropractic treatments, particularly neck adjustments, can pose significant risks, as highlighted by the tragic case of Joanna Kowalczyk. After experiencing a crack in her neck during a workout, this 29-year-old sought chiropractic care instead of hospital intervention. Unbeknownst to her practitioner, Joanna had underlying health issues, including a connective tissue disorder, which made her more susceptible to severe injuries like arterial dissections. Unfortunately, her chiropractor failed to review her medical history before performing neck manipulation. This oversight proved fatal, as the adjustment led to acute dissections, resulting in her untimely death. This incident emphasizes the critical importance of comprehensive medical evaluations prior to any chiropractic intervention, especially for individuals with known health vulnerabilities. While many seek chiropractic care for relief from pain and discomfort, it is vital to understand potential risks. Patients should always communicate their complete medical history and consult with healthcare providers to ensure safe practices. Awareness and caution are key to preventing tragedies connected to neck treatments and chiropractic care, making it imperative for both practitioners and patients to prioritize safety in their approach to treatment.